As we journey through life, taking care of our health becomes an ever-evolving process. Entering our 60s is a milestone that often prompts reflection, not just on the years gone by, but on the best ways to maintain vitality, independence, and quality of life in the years ahead. Routine health checkups and screenings have long been considered cornerstones of preventive medicine. However, recent research and updated clinical guidelines reveal that some tests, once thought essential, may do more harm than good for older adults. Understanding which health screenings to reconsider after age 60 is crucial for making informed decisions and safeguarding your well-being. Let's explore 6 common health checkups that experts now recommend seniors avoid, based on the latest findings. These recommendations are shaped by the U.S. Preventive Services Task Force and other leading organizations, prioritizing recent evidence and a personalized approach to care. First, let's address prostate cancer screening using the prostate-specific antigen, commonly known as the PSA test. For years, this test was routinely recommended for men as they aged, aiming to catch prostate cancer early. Yet new guidelines have shifted dramatically. The U.S. Preventive Services Task Force now advises against routine PSA screening for men aged 70 and older. Why? Research shows that the potential harms, such as false positives, unnecessary biopsies, treatments that can lead to incontinence or sexual dysfunction, and the anxiety these consequences often provoke, frequently outweigh any possible benefit. Most prostate cancers detected in older men are slow-growing and unlikely to cause harm within their lifetime. For men in this age group, continuing with PSA testing may lead to interventions that diminish quality of life rather than preserve it. Instead, shared decision-making with your physician is encouraged, weighing personal risk factors and overall health status before considering any screening. Next, ovarian cancer screening in women deserves scrutiny. There's a common misconception that routine screening can catch ovarian cancer early and improve survival rates. The reality is more nuanced. The USPSTF explicitly recommends against screening asymptomatic women for ovarian cancer. Current tests, including blood markers and imaging, have not proven effective at reducing mortality and often yield false positives, leading to unnecessary surgeries and emotional distress. For seniors, the likelihood of benefit is even lower, while the risks of invasive follow-up procedures and complications increase. If you're not experiencing symptoms like persistent bloating, pelvic pain, or changes in urinary habits, routine screening is not advised. Instead, focus on regular check-ins with your healthcare provider and report any unusual symptoms promptly. Lung cancer screening is another area where recommendations have become more targeted. Screening with low-dose CT scans is reserved for those with a significant history of heavy smoking. For older adults without such a history, routine screening is discouraged. Studies show that the risks, exposure to radiation, false alarms, unnecessary biopsies, or surgeries can outweigh the benefits for those at low risk. Lung cancer screening is not a one-size-fits-all tool. It's best reserved for those who are most likely to benefit, namely individuals with a substantial history of tobacco use. If you're over 60 and have never smoked heavily or quit decades ago, you can likely forgo this test without worry. Abdominal aortic aneurysm screening is another checkup that has come under reconsideration, especially for older women. An abdominal aortic aneurysm occurs when a section of the large blood vessel running through the abdomen becomes weakened and bulges. While screening may be beneficial for certain high-risk populations, such as older men with a history of smoking, the USPSTF now recommends against routine screening for women regardless of age. The rationale is clear. The prevalence of abdominal aortic aneurysms in women is low, and the risks associated with screening, including false positives and unnecessary surgical interventions, can be significant. For women over 60, unless you have specific risk factors, this test is likely unnecessary. Moving beyond cancer and vascular screenings, bone density testing is another area where routine screening can sometimes be excessive. While osteoporosis and related fractures are real concerns for older adults, especially women, recent studies suggest that frequent bone density scans, more than once every few years, do not provide added benefit for most seniors. In fact, overtesting can lead to overtreatment, including medications that carry side effects such as digestive problems, bone pain, and rare but serious complications like jaw osteonecrosis. For those already diagnosed with osteoporosis or at very high risk, periodic monitoring is appropriate. But for healthy seniors with average bone density and no new risk factors, spacing out these tests is now considered best practice. Lastly, routine colorectal cancer screenings beyond a certain age warrant reconsideration. Colonoscopies are invaluable for detecting polyps and preventing cancer, but their benefits diminish with age, particularly after 75 and almost certainly after 85. At these ages, the risks associated with the procedure, such as bowel perforation, bleeding, and complications from sedation, become more pronounced, while the likelihood of detecting a life-threatening cancer declines. The USPSTF suggests that screening decisions for colorectal cancer in those ages 76 to 85 be made on an individual basis, taking into account a person's overall health, life expectancy, and prior screening history. For healthy seniors who have had regular screenings with no abnormal findings, continuing routine colonoscopies may not be necessary. Instead, discuss your health goals and preferences with your provider to determine the best approach. Taken together, these 6 screenings, PSA for prostate cancer, ovarian cancer tests, lung cancer scans for low-risk individuals, abdominal aortic aneurysm screening for women, frequent bone density scans, and colorectal cancer screening in advanced age, reflect a shift toward more personalized, evidence-based care for seniors. The goal is to avoid unnecessary procedures, minimize harm, and focus resources on interventions that truly enhance health and longevity. But why have these recommendations changed? The answer lies in a growing body of research showing that tests and interventions are not benign. Every screening carries a risk. False positives can lead to anxiety, invasive follow-ups, and treatments that affect physical and emotional health. For older adults who may have other medical conditions or limited life expectancy, the harms can quickly outweigh any potential benefit. The updated guidelines emphasize the importance of shared decision-making between seniors and their healthcare providers. Rather than following a checklist of tests, discussions should center on individual risk factors, medical history, and personal values. For example, someone with a family history of early-onset prostate cancer who remains in excellent health and has a strong preference for aggressive screening may choose a different path than someone with multiple chronic illnesses and no significant family risk. These conversations are vital for ensuring that healthcare remains both effective and compassionate. It's also important to recognize that the absence of routine screening does not mean neglecting your health. Instead, the focus shifts to regular physical exams, monitoring of chronic conditions, lifestyle interventions such as exercise and nutrition, and prompt attention to new symptoms. Preventive care remains a cornerstone, but it's increasingly tailored to the individual, rather than dictated by age alone. For seniors, this approach offers several benefits. First, it reduces exposure to unnecessary tests and procedures, which can lead to complications, hospitalizations, and reduced independence. Second, it alleviates the psychological burden of false alarms and overdiagnosis, the anxiety that comes from uncertain findings or the shadow of a disease unlikely to manifest meaningfully. Third, it opens the door for more meaningful conversations about health goals, quality of life, and personal priorities as we age. So, what should you do if you're overseas and wondering about your next health checkup? Start by reviewing your personal and family medical history, current medications, and any ongoing health concerns. Schedule a visit with your healthcare provider and ask about which screenings are recommended for your situation and which may be safely skipped. Bring up the latest guidelines discussed here and express your preferences and concerns. Remember, the most valuable healthcare is not always the most aggressive. It's the care that fits your life, values, and medical needs. In summary, modern senior healthcare encourages us to be thoughtful and selective about screening tests. The days of blanket recommendations for annual cancer screenings and frequent scans are fading, replaced by nuanced, individualized care. By avoiding unnecessary health checkups, such as PSA tests for prostate cancer in older men, ovarian cancer screening for asymptomatic women, lung cancer scans for those without heavy smoking history, abdominal aortic aneurysm screening for women, frequent bone density tests, and routine colonoscopies in advanced age, you can protect yourself from interventions that may do more harm than good. Ultimately, the path to healthy aging is not paved with endless tests, but with informed choices, open dialogue with your provider, and attention to what matters most for your health and happiness. Embrace this new era of senior care, one that respects your needs, values your time, and focuses on the screenings and interventions that will truly make a difference. Your health journey is unique. Make sure your checkups are too.